Good afternoon, everyone. Thanks for joining us today, joining the National African American Tobacco Prevention Network as we host promising practices for tobacco prevention and control in African American communities. This will be a webinar and live panel discussion. The National African American Tobacco Prevention Network, or NAATPN, we are a national organization dedicated to facilitating the development and implementation of comprehensive and community competent tobacco control programs to benefit communities and people of African descent. NAATPN is one of 6 CDC-funded national networks that engages national and statewide partners by providing technical assistance in tobacco control and prevention activities. The purpose of this meeting today, we are going to discuss and review some outcomes impacting tobacco control and prevention in African American communities. We're going to talk about some promising practices and community competent initiatives that are currently taking place. We're going to look at opportunities for action that could impact African American communities. And we're going to begin a dialogue on how we prioritize these opportunities for action.
So then we actually did the math on it and comparing the lowest quartile with the highest quartile. Pack of Marlboros decreased by 39%, but the price of a pack of Newport decreased by 51%. Okay, this is just the hard data of what these folks have been telling us in the first part of this panel. This is from Boston. The first one was from California. The middle one was from Nationwide sample. This is from Boston. This is Brookline and Dorchester. If you know Boston, Dorchester, historically more African American, Brookline, more upscale. These are storefront cigarette advertising. It's a take-home message. There were greater ads in the Dorchester. There were smaller ads in Brookline, but larger ads in Dorchester. There were off-the-hook more ads on menthol, and of course, again, the take-home is that the average price was cheaper. Okay, so this isn't something we did in California. This isn't something in Boston. This is a nationwide phenomena that the tobacco industry targets our community with these brands, and they're cheaper, and they put more advertisements up about it. If you get a chance, do go to this website. This is brazen, as I say, to say the least. This is Laura Lard. Grown-ups should have the right, should have the freedom to choose whether to smoke. And it has a sister here with dregs, young, assertive, and saying she has the right essentially to kill herself with these menthol cigarettes. Okay, and this is online. This isn't a poster. This is social media. So they're right in line with what's going on today. Some remedies. I would encourage people that are involved in tobacco control in the African American community and all communities to consider some of these things. That one, outlaw excessive point of sale advertising. I don't have time for it. We could show you picture after picture of the fronts of convenience stores and tobacco stores and gas stations placard, literally, with tobacco signs. Standardize the price of cigarettes. It can't be 50 cents cheaper in the black community. Make it the same. Why is it easier for us to kill ourselves? Increase the health warnings on cigarette packages and in stores. You saw the recent court case in New York where New York lost the ability to put a health warning in the store and said that was a federal government thing. We should fight back against that because there should be health warnings throughout the store. Wherever there's tobacco sold, there should be health warning with it. And fourthly, decrease the number of cigarette outlets in our communities. Increase the distance from schools. We know that the closer that tobacco outlets are to schools, that's what a number of these studies were about, the greater the number of kids that will smoke.
Before we you move on to menthol, Dr. Phil, just if we could just talk about this for a minute. Why are they targeting African American communities so hard? I mean, is this a genocide thing? Are they trying to wipe us out? Are they trying to kill us, or?
Well, they've been very effective at killing us. That's unfortunately true. Where it came from is that when African Americans moved into the northern cities and even into the southern cities from the rural existence following World War II, a new market was created, a niche market was created. You had specialty hair products, specialty alcohol products, specialty products around. This was a special product for African Americans. There were different smokes for different folks. And this is where this came from in the early 50s. Aha, to exploit this market, let's exploit it differently. I mean, it took off like a firestorm. I mean, now over 80% of African Americans use menthol cigarettes. So yeah, they're trying to addict as many people as possible. What's interesting, and I'm sure we'll talk about it later, is that African American menthol use has set the tone for menthol use. In fact, most cigarette sales have been going down for the last 10 to 15 years, but menthol cigarette sales and other menthol product sales have been going up amongst all community. So they proved their point. They used us as a guinea pig, and a cheap one at that. So yeah, I think cigarettes by nature are genocidal, and to give them cheaper to poor people in and of itself is genocidal. And the tobacco industry has known this.